Hello everyone. Today we'll be continuing our discussion on hyponatremia, and today we'll be talking about very important aspect of hyponatremia, understanding the intake and output homeostasis. So in the previous lecture we discussed how sodium is regulated and we understood some of the pathologies resulting in hyponatremia and understood how to do basic diagnostic workup. In this, we are going to go into the second part of hyponatremia, which is how much water can you drink for given intake of solute. Normal American diet has around 900 to 1000 milliosmoles a day. So the question we are asking right now is, what is the minimum amount of water that you need to excrete what you ate? So to pee out 1000 milliosmole with minimum amount of water, you need to make most concentrated urine, that is around 1500 milliosmole per liter. And for this, you will need a lot of aquaporin channels in your collecting duct, which is going to absorb the free water that you drink. And this will come from a high ADH state. So let's do some calculations. Your urine concentration was 1500 milliosmole per liter. So your urine can pee out 1500 milliosmole in 1 liter of urine. So to pee out 1000 milliosmole, that is how much you ate, you would need 1000 by 1500, that is 0.66 liters, that 660 cc's. So if you drink 660 cc's of water, you should be able to handle this daily intake of 1000 milliosmole. We are excluding incipient losses here. If you drink less than this, you will not be able to excrete those osmole and your sodium will start rising. Let's ask the next question. What is the maximum amount of water that you need to drink to excrete what you ate? And you are again eating a normal American diet of 1000 milliosmole a day. So for this, you will need to make the most dilute urine. That means you do not need any aquaporin channels. So let's work this out. Your urine can pee out 50 milliosmoles. That is the dilutest urine you can make, and when there is no ADH. So to pee out 1000 milliosmole, you will need 1000 by 50, that's 20 liter of water. So if you drink 20 liter of water, you should be able to handle this daily intake of 1000 milliosmole. But if you drink more than this, for example, if you drink 21 liters, that 20 liters will be used to pee out the 1000 milliosmole, but that extra 1 liter will remain inside you and you won't be able to pee it out. So your sodium will start falling. If you drank any other amount of water between 0.66 liters to 20 liters, your body is going to adjust the level of ADH, which will adjust the urine concentration between 15 to 1500 to pee out what you ate. Your body really wants to regulate your sodium very well. One of the things that you would have noticed is people drinking a lot of water to feel good. Some people will drink up to 2 gallons of water, but they do not become hyponatremic because their body adjusts their ADH level so that they can make more dilute urine to pee what they drank. However, in certain situations, they can become hyponatremic. Let's understand that now. What if you are not eating a normal American diet? Say you're not feeling well and you just ate half your diet, that is around 500 milliosmoles per day. What is the minimum and maximum amount of water you need to drink to excrete what you ate? So to require the minimum amount of water to drink, you again make maximal concentrated urine, that is 1500 milliosmole. So you will need around 500 by 1500, that is 0.33 liters of water to pee out that 500 milliosmole. And you can drink up to 10 liters similarly by making very dilute urine, and you should be able to handle your 500 milliosmoles. So your kidneys have limit to how much they can dilute and concentrate urine, and your body does that by using ADH. Homeostasis depends upon how much osmole you ate, how much water you drank, and how is your urine diluting or concentrating ability. So you can use this information to figure out how much water restriction you need for your hyponatremic patient, and that's why it's very important to look at urine osmolality. If you know how much osmole you ate and you know your urine osmolality, you should be able to tell how much minimum and maximum amount of water that you can drink to keep your sodium stable. So let's talk about psychogenic polydipsia, beer potomonia, and tea and toast diet. The problem in this condition is they are drinking too much water for a given amount of solute. So in psychogenic polydipsia, say for example, this person is eating around 600 milliosmol per day. If he drinks more than 12 liters of water, he's going to drop his sodium. In beer potomania, beer which has almost no solute in them, and to pee out a very low amount of solute, for example in this case 100 milliosmoles, these guys just need 2 liters of water before they become hyponatremic. People who drink a lot of water, they have to keep up with their solute, otherwise they will become hyponatremic. Let's see if you can calculate the amount of solute that these persons need to eat to prevent hyponatremia if they drink 2 gallons of water. 2 gallons is 7.5 liters. How do you figure out if somebody is drinking too much water? Well, simple answer is check the urine osmolality. So when you're drinking too much water, your body will be doing its best to pee out all the free water that you drank. So your urine osmolality will be very low, usually less than 100 milliosmoles per liter. If urine osmolality is not available immediately, you can get some idea by looking at urine analysis and looking for urine specific gravity. As your urine gets more dilute, urine specific gravity is going to fall. If you remember the word isosthenuria seen in CKD patient who are unable to concentrate their urine and their urine osmolality is around 300, similar to serum osmolality, and the specific gravity is 1.010. If you see urine specific gravity less than 1.010, that would be suggestive of dilute urine. However, make sure that you check urine osmolality to confirm that. So what happens in high ADH states? If your ADH is present, you will have aquaporin molecules in your system, and as your ADH levels rises, more aquaporin channels come into play. So your diluting capacity of the kidneys gets worse and worse. So you are unable to dilute your urine, in this case less than 600 milliosmoles per liter, because ADH is present all the time. For example, a patient with lung cancer with ADH secreting tumor would have high urine osmolality compared to a normal person. These guys can still make more ADH and make more concentrated urine, up to 1500 milliosmoles per liter. So let's see if this person eats a regular American diet, how much is the maximum amount of water that he can drink. To figure out maximum amount of water that he can drink, this person has to make the most dilute urine. However, because of his ADH state, his urine diluting capacity is unfortunately at 600. So his urine can pee out 600 milliosmol in 1 liter. That is the lowest dilution they can achieve. So pee out 1000 milliosmol, he will need 1000 by 600, that is 1.6 liters of water. So if he drinks 1.6 liter of water, he should still be able to handle what he ate. But if he drank more than 1.6, his sodium will start dropping. For comparison, in a normal person, his urine diluting capacity was around 50. So he could drink up to 20 liters of water before becoming hyponatremic. The diluting capacity of kidneys gets worse with increasing ADH, and you must drink lesser amount of water to excrete same amount of solute you ate. So a person with high ADH state will become hyponatremic easier. So how can you find optimal fluid restriction after knowing what you just learned? A lot of us will use a random number like 1 or 2 liters for fluid restriction for everyone. However, there is more logical and scientific way to do this. We'll discuss about this in our next lecture. So in summary, your sodium level depends upon 3 factors: how much osmoles you ate, how much water you drank, and how was your urine osmolality. Thank you.